4 months ago, this journey began with a camera, a passport, and a purpose. Today, we'll reach 20,000 subscribers. Thank you for traveling the world with me, uncovering hidden stories, and making a difference along the way. Like, subscribe, and turn on notifications. It's the Unfiltered World with PA. All right, welcome to the Driving Five at PA here in the studio. We got the big boss in the building, Big Rob.
Big boss.
Yes, we have two beautiful people who are African-American descent who are in charge of their respective department at Muskegon County. And one of them was Karen Boyd, which we had on, Karen Boyd Whitehouse, which we had on a couple weeks ago. And today we got Kathy Moore here from the Public Health Department. How you doing,
Absolutely.
Kathy?
I am doing great. Thank you, Paul and Big Rob. And Karen is one of my favorite people, too. So that's amazing. She is my sister.
So,
that's amazing.
And both of y'all are from Muskegon Heights. Too.
Yes, we are.
There you go.
So rich people just hang out
That's
with
how
each
they do.
other.
No,
You know,
we're just like deep in public service.
Because, one went to Michigan State and the other went to Michigan. Because you went to Michigan, right?
I did. I have one degree in Michigan. I
One
went to several. Yes.
You went to MCC, what else?
Grand Valley State University.
Okay.
Yes.
And so what degree did you get at Michigan?
Michigan is a public health leadership degree and a master's of science in accounting.
Wow.
So you good with numbers.
You could be the county administrator if you wanted to.
I don't think so. That's a lot of political stuff that I can't handle. Yes.
But you're capable. You don't want it. You don't want it.
I don't know if I'm capable, but yes. That's, the county administrator is my boss. He is just an amazing person.
Mm-hmm.
And I think I'm successful because he allows me to be. So,
And he's a good man.
yes,
He
he's a
is.
great man. I wouldn't sit here saying I'm going to take his
No,
job.
you don't. She's not going to take your job.
Yeah.
You safe there. But we got to elevate our sister now. We ain't going to say like she's not capable. Because I know.
So I think what is interesting, Paul, is that, of the 1,200 county employees, I am the most senior county employee.
What?
So I've been with the county longer than anybody affiliated with the county. So
Kathy, I see people strolling, like having a hard time walking out of the county building that work there.
I've been there the longest. So
You started
30
right out of
36 plus years. Yes.
right out of college?
No, I actually had some other jobs. So I'm a little older than I pretend to be. I got a son that's graduating this year from high school. So I had a child after 40.
Wow.
And
Wow.
it keeps you young. It keeps you going.
Wow. I mean, I know we were in school at the same time, and you're a couple years, but you don't look old. You don't look older.
And I don't feel old.
Yeah.
I like what I do. I like where I live. I like the people I affiliate with. And I think, I feel like that positive attitude helps. Like it helps with the stress. And it just helps me go day to day. This is an amazing world. And if something happened today, I am so blessed and so grateful for everything.
Well, you've been a great role model. You did a public health, minority health report. It's probably been a long time
It
now.
has been a while.
It's still fresh in my head.
Yes.
But what can you share, or any updated data on health in Muskegon County, or maybe not just minority health?
Yeah. So the recent one that I'm a little concerned about is our increase, so high prevalence of attempted suicides.
Ooh.
And I know that we track suicides, and those are permanent. That's sad.
Mm-hmm.
But to see an increase in attempted suicides is a very concerning to me, actually.
So how big an increase is it?
Well, and we're getting the reports from month to month, but right now I'm just comparing it to last year, and I'd have to go back and look at some other years, but there are sometimes 16%, 20%, definitely double-digit increases.
Wow. Wow. So that's a mental health issue, right?
That is a mental, emotional, sometimes social economic. Like sometimes it's a mental, emotional, and coping concern, where I would say mental, emotional, where, we have access to social media and all these amazing TV shows and things, and people are comparing their life to maybe a life that's not real.
Right,
Really?
Yeah,
Wow.
they're trying to uphold some standards of influencers or just popular people, and popular people. That's a show sometimes. Like they're not as happy as it seems.
Yeah.
Yeah,
Um,
yeah, not just sometimes, Kathy. I think it's all Hollywood.
and
Yeah.
we're in an era of instant gratification, and like I said, I've been there 36 years, so it wasn't instant for me,
hmm
and then automatically assuming if something happened, it was directed towards you. Sometimes things happen and that person is just going through something. It doesn't matter that it was you that got affected. And so just trying to look at that broader. But it's mental, emotional, and the ability to cope.
Right.
And I threw social economics in there because our cost of living is up, and some people don't know where they're going to live or how they're going to pay for competing priorities.
So the stressors
Yes.
is the stress from worrying about a mortgage or a
Yes.
car note or
And
or being
some of them,
homeless.
even with a diagnosis and the stressor of feeling like they don't know how to cover the cost or what the solution is, like the long-term solution.
So what changed? Because I mean, I think we always dealt with stress.
Yes.
I think I've always had to deal with stress. But
Yes.
what changed now to make us not be able to handle it?
I really do think it's some of the internet, social media, TV shows. It makes it look like other people are living a more thriving life than we are, and almost that instant gratification. Like
hmm
like people want the stack of bills and the nicest car and the nicest house, and reality, we might not can get all that all at
Right.
once,
Right.
and everything is basically sacrifice and discipline, but you don't see that on social media. You don't see that on the TV shows.
You just see the finished product.
You see the finished product,
That's it.
and a lot of times you don't know that person until they're famous,
Yeah.
so that's all you see.
Wow. Wow. Has it impacted you, Rob, social media?
No, I don't. I'm not on it like that. The most I'm on is on TikTok, and I'm laughing and joking at other people's
Yes.
stuff. I don't try to look for it to make me think a different way or whatever and stuff like that. There is some interesting things that come up, but I believe in what the Honorable Minister Louis Farrakhan said: when you see something, go research it and see if it's any truth to it.
Yes. And
You
then
know,
don't compare somebody's life to yours.
right?
They say that comparison is the killer of joy.
Mm.
And
hmm
we know that even our siblings, we grew up the same, exposed to the same things, and we're different from our siblings. We
Yes.
have different levels of achievement.
Right.
So to look at somebody else and say, how can they afford that and I can't?
Right.
Or why are they always, looking good or dressed nice? It things come in moderation.
Yeah.
Wow. So that is the big issue: suicide attempts,
Oh my. It's
even
it's
among
really
African
disheartening.
Americans.
Yes, it's very disheartening, and age groups. So young people and even older people now.
Older people,
Yes,
people our age.
people our age, and I was thinking a little older, but yes,
Oh, a little
yes,
older. Wow.
yes,
Wow. Senior citizens.
yes, yes.
Yeah, we senior citizens, PA.
Wow,
Right.
I need that check, bro.
yeah.
Run that. I'm signing up as soon as it's available.
Yeah,
But wow, how do well, how do we prevent that?
I think we have to approach it. We have to be, first of all, like what you guys are doing, being here in the community. We have to be more present in the community, meeting people where they are,
Yeah.
and not thinking like it's government that people just need to come to us
Right.
and they need to fit within our parameters
Yeah.
to be available. Different people resonate differently with different people.
Yes.
And we have to, what we're trying to do in public health is expand our reach and have a multitude of people working with us and for us, because they may not like, this older Black woman. They might resonate better with the rural white man. I want to work with that rural white man.
Right.
I want to do whatever it takes
Right.
to help our residents have hope.
Do you think that sometimes as people don't want to help as much as like us three here, we got receipts?
Yes.
People don't want to help anymore. They just want the end result.
They do. I think we may have conditioned people to just get this instant thing. So
Right.
sometimes you don't qualify for like your property taxes paid unless you're in
Right.
this situation.
Right.
And so in a way you could be conditioning them to put themselves in that situation
Right.
so they qualify for this one thing, not realizing that's really setting you back in other
Right.
categories. Um,
So what about it used to be STDs? So we good on that now? We're
And,
not
well,
we're not getting chlamydia out here now.
STDs, sexually transmitted infections, is still a huge concern. And it did go down during COVID, but of course there was a stay-at-home order and things like that.
I shouldn't laugh.
Oh, but you know what? Some women, remember, some women, especially Black women, they're like, nope, not sleeping with you right now. So it was a little hiatus, and I appreciate that.
Hating on the guys. Hating on the guys. Hating on the game. Wow.
But we do still have people out there, and so a lot of what we're doing is these community assessments and people telling us what it is that they need, and it's transportation, it's housing, it's jobs. But I told one of my group of leaders, like nobody's going to say, I need to stop having sex with multiple people, or nobody's going to say that's their need.
Right.
But our data show that is a need. So the secondary infections is up now. And that's an indication. Like, secondary infections are people that we have already identified as positive STI. We've called them in, we've treated them. We've asked them who your partners are, and we've tried to treat them. So either we're not getting told all the partners,
Right.
but then we also ask them to abstain for a certain period of time so that the medication will take effect.
Yeah.
They're just getting reinfected, and it's not even just secondary reinfections. It's the third time and the fourth time.
The antibiotics not working.
Well, I don't know, Paul.
They're going
feel
back
like,
to the same place they
like
got it.
because we treated them and because they found out this is occur, like maybe they're not as afraid of it anymore. Just and I don't even want to use, Magic Johnson's name, but at first, this is terrible because I've been around since his first diagnosis.
Right.
And I thought this might work in our favor because people would say,
I'm not
hey,
gonna do that.
this happened to Magic. This could happen to
Anybody.
Exactly,
Yeah.
anybody.
But then they see this big, healthy, rich guy living his
Looking
best
good.
life.
Right.
And
Shining.
they're thinking maybe it's not that big of a deal. It's still a big deal.
Right.
It really is.
So not knowing that the STDs, chlamydia, are there long-term effects for having chlamydia?
There are for the women, which a lot of it is sterile. It could really stop them from having kids or having healthy kids.
Oh, hell.
And sometimes over time, that's not even a threat. Like if you.
They're okay with that.
Yes.
But one of them make you go blind, right?
Yes.
Syphilis?
Syphilis.
That
Yes.
should be a threat.
That is a threat. And, to me, the research shows that anybody that is sustainable for anything, even chlamydia, is at higher risk for HIV, syphilis, herpes, all of those.
Wow.
How is our HIV rates and AIDS?
HIV, AIDS for local is pretty good. We have
Wow,
we have people that move into our community. I'm not sure why or how, but we have to follow up with individuals who are not Well, they are residents now, but they weren't here for many years.
Mm, okay.
Um,
Returning citizens?
Not necessarily. They're coming here. I don't
They're just
know.
moving here.
They're moving here.
And so they might have the illness when they come,
Yes,
a
yes,
disease,
yeah. They were
Mm.
diagnosed before they
and move to a
transferred
new
here.
market.
Yes.
Online, attorney Brianna Scott said, "Hey, Sarah, Kathy Moore."
My girl Brianna Scott, Sora Brianna Scott, and MSU, um, MSU
Trustee.
candidate trustee.
Yeah.
Like, yeah. So just so glad you made it through that level, and wishing her the best of luck with the big election.
You know, this just make me think. Our kids have some amazing black females to look up to.
Yes.
I'm just thinking, what just
Yeah.
Brianna. I know
Yeah.
Brianna. You, Karen, and there's so many names.
So many.
So
Right.
many
So many.
names. So many bosses. You know,
Yes.
Muskegon Family Care
Yes.
to other organizations around here, and I just want to tell y'all, I love y'all. I
Yes.
love y'all. I
Oh my
appreciate
goodness.
y'all. Y'all make us better
Yes.
and make us step our game up.
So even with Brianna encouraged me to pledge Delta, and
Mhm.
so I crossed Delta Sigma Theta Sorority Incorporated, and the sisters, the local chapter, Muskegon Heights Alumni Chapter, the sisters involved in this sorority is absolutely phenomenal.
Yeah.
Yeah.
I mean,
Yeah.
we are just a powerhouse.
And they're like that everywhere.
Yeah.
Yeah.
We have a
Oh
great.
my.
They like that everywhere. The Deltas are
Absolutely.
represented.
Oh yeah.
Oh,
They,
everywhere.
they've been.
I was so impressed, and Brianna know because Brianna and I have both been involved in Rotary, and we're still involved with Rotary. Rotary is international, and it's always, we're in awe when we see that at that level.
Mhm.
But then to see black professionals,
Yeah.
female black professionals,
Educated.
educated,
Yes.
operating at that level,
Right.
and with the primary purpose to give back to the community,
Yeah.
to do positive things for the community. It's amazing.
Wow.
And I know
There's so
De'Erica.
much hope for this world.
Oh, yeah.
because deltas exist. No, the whole divine nine. The whole divine nine.
The Deltas they just dropped off a bunch of pads today
Yeah.
for
Oh,
the
really?
girls in Africa.
Oh,
Yeah.
wow.
Miss Nichols.
Yes.
Oh,
Yeah, she been over here last couple of weeks dropping off bags.
So we
Talking about when y'all sending them, I
yeah,
need
we
to
got
know.
about 9 barrels. Well, we got more than that. No, we got about 20 barrels. We
They
sent
are
to-
20.
It's a quiet kept secret. They are the best example.
And
of
they
people doing well.
every year,
Yes.
every year you guys donate to, and it ain't nothing small. I mean, I think the smallest one y'all did was the first year, and y'all filled up a 55-gallon barrel.
Oh wow.
So Miss Nichols is like,
Miss Nichols,
basically
yeah.
like, y'all ain't nobody else beating us.
Right.
So every chance she got, she bringing
That
them
is
in,
so awesome.
So
So
yeah.
before we go, Kathy, any other illness that we should be aware of? How's high blood pressure?
So we're trying to empower our residents to really take control of their own health. So we should, think about how we feel, but get those regular checks and eat a little better, move a little more, and just that little bit
Will help.
will help a little bit.
Right. So what about food? Is our diet bad?
Diets are bad, sugar is bad,
Sugar.
but not to the point that it can't be corrected.
Okay.
So we are on this. We're trying to promote this initiative, food as medicine,
Mhm.
and we've always known apple a day keeps the doctor away, and some of these traditional things that we're trying to encourage people to go back to just eating healthier and not relying on the doctors to heal us all the time. We have to think that we might get to a point where there's not enough physicians to go around.
Right.
We can't take for granted that everybody's gonna just be here to save us. We got to try to
Right.
save ourselves
Hey,
sometimes.
that's it.
Right.
And that's our newest approach and initiative with food as medicine. Encourage some gardening, home gardens like on your deck or in your house, front yard, backyard, whatever. Grow whatever you can. That helps that helps with the grocery bill as well.
Right.
Yeah.
Or read the book, Elijah Muhammad, How to Eat to Live.
Oh yeah.
There you go.
Yes.
Yeah.
Anything else you want to share?
Just that, we are, we want to partner with a lot of nonprofit organizations as well as individuals, grassroots, because we're trying to reach more people. We know that people don't necessarily trust government. And we are not on top of social media. Like, we don't know how to get our message across, communicate with everybody. So the more partners we can have, I think the greater impact, the bigger positive impact we'll have. So just help us, and we want to partner.
Muskegon County Health Department, and you're on Marquette now, right?
We're on Marquette now, but we have a mobile van, and we will come to you, and we'll work with you. We'll make something happen.
Wow. Well, we got to do better of getting you in. I know we have Brandon every week, but we got to get you in more often. Because we love talking to the boss too.
Yeah.
And what you stand for. I know you're a trustee from Muskegon Community College.
Yes.
I know you come here for that, but how are things there?
I am loving where Muskegon Community College is going under the leadership of Dr. John Selman. They, are graduating, more people. We partnerships with four-year universities for transfers, introducing some micro certifications so that people feel like they're achieving something all along the way. So a lot of good things happening. And our 100th year anniversary.
Yeah.
Muskegon Community College is this year, and the 50th year anniversary for the Muskegon Heights alumni chapter of Delta Sigma Theta Sorority Incorporated.
Oh, wow.
This year as well.
Wow, that's amazing.
You see, she don't say it like Kaya and them taught me.
Right.
Incorporated.
Kathy just getting off work. You know what I mean?
Yeah.
You can hear her voice, man. She's been yelling at people today.
She's been yelling at people today.
Just checking people over there. Whooping that whoop out. Thank you so much, Kathy.
Yeah.
Appreciate you. All right, Muskegon. That's the big boss of Muskegon County Public Health, Kathy Moore. Going back to my music.